Good morning. I'm Jocelyn, pelvic floor physical therapist and owner of the Vagina Doc Physical Therapy and Wellness. I hope you are having a fabulous morning so far. I know I am. It is about, I would say, 65 degrees in Scottsdale, Arizona. I worked out this morning. I felt refreshed when I woke up. It's just been great. And I hope that your morning's going great as well. And today I wanted to answer the question, does everyone need a pelvic physical therapist? And the reason why I wanted to answer that question or talk about that is because I was recently interviewed for a podcast and they asked me this, and I used to say, yes, every person should see a pelvic physical therapist. And I've kind of changed my perspective a little bit. Yes, I do think everyone should have a physical therapist as their primary care team, and here is why. Number one, when I see someone, typically if it's after a surgery or after something has already happened, that person doesn't necessarily know how to recognize patterns or things that would indicate an issue. The best example would be the times that I have had patients that actually ended up having a neurologic disease. And they didn't know the little subtle signs and symptoms throughout the past 5 years that could have been leading to that. And some may argue, well, it's inevitable and it's progressive, so why worry or burden someone with that? Well, I hear that question. I ask myself that question as well. But there are behaviors that one can make to slow the process or to maintain what they have before the decline starts. And so I have been more frequently seeing people that may have more sinister things that are underlying and have not come up to the surface, but there's no baseline that I have except where I start with them, versus if I were to see people every 6 months, I would be able to see their movement patterns and see, oh, you're doing great, you're maintaining, you are, or you're improving, or no, you aren't. You're displaying characteristics that are actually concerning. The thing that comes to my mind is heart disease, or women, post-menopausal women in their 60s and above that have maybe had a surgery and now their activity is significantly reduced. And they don't have the protective effect in their blood vessels and arteries that estrogen provides. So there is something that our body does. It releases nitric oxide or some sort of molecular enzyme that creates more of a space, a dilation in the vessels so that blood can get through. Well, as we age and there are less enzymes available that run that process or drive that process, things are slowed. So what I have been really seeing in my women that are postmenopausal and are getting older is these characteristics that I don't like, that they're slowly displaying signs of heart disease or something of that sort. So the benefit of having a therapist, whether it's a pelvic physical therapist or just a musculoskeletal neuromuscular, just a regular physical therapist, is they have the eye to recognize problems that tests aren't often performed by a physician unless you're already sick. The power of movement is beyond what you can even imagine. So where I want to go into my practice is that if I am going to be seeing people, I want to see them every 6 months, because I can see how their health is by their movement profile. And in that case, I can communicate. I could be the referral source. Okay, this is what's going on. This is what I see. I can't test it because I'm not a medical doctor. I'm a doctor of physical therapy, but here's the steps you need to take next, and here's how to advocate for yourself. Or I could take the initiative and call their primary care and say, hey, this is what I'm seeing. I saw them last 6 months. They were here, and now 6 months later, they're not, and they're displaying these movement characteristics that I don't like, and here's what I suggest from my end. What do you think? So, back to the original question. Does everyone need a pelvic physical therapist? My thoughts are, at minimum, women should be seeing a pelvic physical therapist before they become pregnant, to get a baseline. Okay, as you're pregnant, here's your movement profile. Here are the things that you should do as your movement medicine, because here's how your body is going to change. Then I want to see you as you transition into mid to late second trimester and third trimester. And then I want to see you postpartum, and we come up with a plan. If people have problems, then we start a new plan of care. If not, okay, bye. Here's what you should be focusing on in addition or in complementary or part of your movement exercise routine. Simple. Where we need to be careful is basically doing unnecessary testing to create this fear in people. So I don't think as a professional, if you don't have that language down, or if you don't have the confidence in your systems review and your differential diagnosis, then that's maybe not for you. But for me, I feel like my differential diagnosis process is so sharp because I was such a nerd in college and in PT school and as a provider. If I don't know something, I just dig deep into the books to figure it out and learn. And I've treated the very complex people and people with low function that really were my biggest learning lessons, because of all the things that I had to do on a learning standpoint to treat them. Do I think everyone needs a pelvic physical therapist? I asked that again. Yes, but not for constant treatment. It's just like, here's where you are. For women specifically, our bodies change so much. Like adolescent to around mid-20s, where we develop into our women's body, and then around if you get pregnant, and then after you're pregnant, and then if you get pregnant again, and then perimenopausal, menopausal, postmenopausal. There's so many changes that most humans are not educated on how to take care of their body, and they shouldn't have to. That's what people like me are here for. And you should be investing in yourself, because for you to be your best, serve your family, your job, the world, you have to be functioning without distractions of disease or pain. So, if you are interested in really living at your highest self, consider finding a physical therapist to be your dentist, but for movement, because movement tells the story. And often it's so hard you're not in tune enough. A lot of people aren't in tune enough to catch those patterns, especially when they're weird. Like when I see my patients with Parkinson's disease and other neuro diseases and heart diseases. Hope this was insightful for you all. I really truly believe that the way we move is our most unique human expression, and it shouldn't be ignored. Happy Thursday. I will be back tomorrow. Until next time on Real Talk with the Pelvic Doc. Real Talk with the Vagina Doc. That's my podcast. But speaking of which, if you haven't checked out the podcast, check it out. It's Real Talk with Pelvic Docs. It's on iTunes and Spotify. You can check it out on my website, www.thevaginapt.com. And I will see you tomorrow.